as of the end of November, contact tracing from the state will end. So we're on our own. And what they'll do is they'll stop taking cases the end of November and finish up any active cases that they have. So by mid-December, they're out. What we do have here is obviously Pam doing contact tracing as well, but we do have 2 other contact tracers that we use. And those are being funded for, from all COVID money, the CARES Act money, but that ended in end of October. So now we're working to fund these 2 positions with the FEMA money related to COVID. And we also have an office assistant that we're using COVID money to help us, her just do general office work as we're, busy setting up the clinics and doing everything else. And with that in mind, there's really no other changes. Everything else I can go over right in order from what is on the agenda. Unless there's any questions anybody has here.
Okay.
All right.
Move on.
All right, moving on. Flu clinics. Let me bring this up here. And Michael, can I share screen here? Where do I go for that?
Yeah, you should be able to share on the bottom of your screen.
Bottom, record, hand up, share. Here we go. Okay. Okay, this is Michael came up with this right here. We had a total of 9 clinics for flu. Now these are all flu. 430 shots given. And this breaks it out by location. So this is where Pam and Michael went each time. And this is after learning a whole new platform. The old clinics we used to have prior to COVID, I don't know if you remember, everybody came in, filled out a form, and then, excuse me, Pam at the end of the clinic would have to manually enter all that information. Now it's all pre-registration, and anybody that walks in, Michael was there for the ability to input them into the system, but once they're inputted in, they just come in, get their shot, and then the nurse will bring up their file and then just put in which arm they got their shot in, and then they'll close that case out, and then automatically goes, to the billing software that we have, and it gets also recorded into the MIIS, the vaccine portal through the state DPS. So it saved a lot of time and effort on our part in terms of copying and inputting data. So again, compared to the numbers from last year, I believe that this is a little lower. And we did have the clinic late because of vacations and everything else. And again, short that position at that time. So with the availability of the shots at CVS's and Walgreens and all that, but 430 is a good number. So, got any questions on this here? Okay, so I can unshare this. Stop share. Here we go. Okay, and what's next on the agenda?
COVID-19 update.
I'm sorry?
COVID-19 update.
Okay, COVID-19 update, our favorite subject. All right, this came together fairly late. questions are, what are we doing for boosters? And what are we doing for the 5 to 11 group? The booster question right now, we partnered up with Salisbury. So Jack Morris from Salisbury actually called me and said if I wanted to have access to his clinic. He's got his clinic at the senior center. And the person running that clinic is Connolly Drug out of Ipswich. I'm not sure if you're familiar with that. He actually got his allotment of vaccines from the federal rather than the state. So they already had one clinic last week. So they were able to offer all 3 vaccines, Moderna, Pfizer, and J&J, for either boosters or that 3rd shot or 1st and 2nd. So I'm just trying to bring up the portal here. Just bear with me a second. Remote. Okay. I'm going to go to share screen again, Michael. So this is the, Jack sent me a link, so we sent it out to the senior centers. And it's also on the Salisbury website, and we also listed it on the Newburyport website. So again, ages 12 and up, the third booster. It gives a time frame that they should be getting their 3rd booster, let's say for Pfizer, Moderna, 6 months after the 2nd shot, and J&J 2 months. So this is the upcoming clinic on Saturday, and then there's going to be another clinic the following Saturday. And again, when you click on the link, these are the questions that you'll be asked. Times available here on the right. And again, just vaccine information, gender, insurance information here. And that's about it. I thought it was a great opportunity for us because he's coming in fully staffed. So Jack is just applying the venue, there's applying everything else. So I'm going to go there actually, just for some support since they did offer it to us. And then as of today, actually, I got another email here. And this is not official yet, but where is it? Let's see. There. One more second. It's on. Email here. I just got an email from the director of West Newbury. And as you remember, between West Newbury and Amesbury, those were the venues, and Amesbury is a host agency for the whole Merrimack Valley Collaborative. And we are planning to do clinics. So let me see if I can do it this way. Okay, here we go. Share screen. I'm sorry. Okay, what we're going to be planning with the collaborative is clinics in West Newbury at the annex we're trying to go for Monday night clinics. From 4 to 7, as you can see here. And the dates, again, it's not official, but we're looking for November 15th, 22nd, and 29th. And these will be for the 5 to 11-year-old groups. I'm not sure if they're also going to be doing boosters, but right now we're just planning for the 5 to 11. And I do want to say that for our kids, what we did between Pam and Lauren, I forgot her last name, she's a new lead health nurse for the school department. She took Kathy Riccio's place. Lauren had set up that we knew that the state has mobile clinics for the 5 to 11-year-olds. So all they had to do was just call the state and request it. So they already set up a clinic, and I'm not sure of the date. I forgot the date. I'll have to go on their website, but it's already sold out. So 500 spots they had for the 5 to 11-year-olds, and they sold out like within an hour and a half. So that's where we're that should get majority of our population. And again, if not, we'll have these Monday night clinics to go around as well. The other thing too is in terms of availability, we can also tell people that both CVS's here in Newburyport and Convenient MD are offering booster shots too, so they can go on their website and make appointments. Okay. So COVID flu, that. If there are any questions there, just feel free, let me know. All right, next we have, I should have done confirmed cases first. Yeah, I just updated the confirmed cases and doesn't look good. We for the end of October, we're at 103 cases, which is 3 cases over September, and September was a very heavy month. And already for the first 3 days of November, we're already up to 20 cases, and that's double what was going on in October. October, we had 10 cases for the first 3 days. Now we're up to 20. What we did find is a lot of our positive cases were coming from the long-term cares. Country Manor had a big outbreak of positives. Avita had a big outbreak of positives, and Atria. And Michael, am I missing any ones? Or those were the 3 main ones, right, that we were dealing with for the past couple of weeks anyways.
And you said KinderCare?
That's right, too. We had KinderCare, we had an outbreak as well. Actually, we just had 2 positive cases there, but because all the kids were not vaccinated, they had to be quarantined as close contacts. The new guidance right now is the close contacts, you don't have to quarantine if you've been vaccinated. However, we're strongly telling and recommending people that even though you're vaccinated and don't have to quarantine, you should get tested. And the new guidance right now is between 5 and 7 days, they should be tested. And obviously, if it's positive, then they'll be considered a isolation for 10 days. And if it's negative, they don't have to do any quarantining. So we are recommending that they do test, even though they were vaccinated, but they don't have to quarantine immediately, which doesn't make sense. Because all of these cases too that we've had from all these long-term care and, well, except for KinderCare, obviously, 99% of them were all vaccinated. So the good news is they didn't have to be hospitalized, but all these COVID cases are from what we can gather from the variant. And it's just affecting the positive people. The hand raised there, Sam?
Yeah, I have all right. The question is so obviously they're testing and that's how we're finding these outbreaks, but how often are they testing? There's, because if they were testing often, then maybe they wouldn't be an outbreak. And are they doing rapid tests or just doing PCR tests? Or how's it
I
going?
know that at Country Manor, they were testing, the state is requiring, I believe. Well, right now they're doing weekly testing. So when they found their first positive, then we worked with the state epi as well. So I believe they may have been on a monthly schedule. And then when the positive came up, then they went to weekly. And I do agree with you, Sam. But they do follow what the state, I guess, is telling them what they should be doing or recommending.
Can
But
we
as-
recommend, like, where's the funding for before I say anything, where's the funding for their testing from? Do they have separate like private funding, or are they doing, and then do we have funding, COVID money for testing that
Good
we can
question. I'll have to ask them, Sam. I'm not sure if they're getting their tests from the state, only because, and they can do it themselves because we do have test kits. However, not enough for for the general public. So it was just like we had a positive case here at one of our departments, and it was a combination of vaccinated and some were unvaccinated. So we were able to just get all those close contacts in, a group of about 7 of them, and regardless if they were vaccinated or not, again, I guess they were all vaccinated, but 1 out of the 7 tested positive as a close contact. So we do have the capability here to test small groups, and the tests we got that from the state, we just requested the kits and they sent it to us. So we do have something available. The schools I know were doing testing on their own with the state as well. But luckily we haven't had any positive cases, except I'll just say recently. Again, when we had the outbreaks happening at these long-term cares, the schools were fine. And then again, I thought that they would be dipping down. However, this week here, where we have a lot of positive cases, and Pam and through her contact tracers and herself found out we're dealing with the Halloween parties now. People throwing Halloween parties, and she was finding that that was a common source. So it was spread amongst the families, especially for the kids at that age group that's not vaccinated. And the other thing too is I was thinking out loud to myself that first it was surprising me that all these vaccinated people were getting it, but it's almost like they're recommending booster shots after 6 months. So these people that are positive had, they were the first in line to get their first and second doses up. So it's well past the 6 months. So I'm thinking that the potency of the vaccine had gone down, and thus they were, now they're giving all their booster shots most recently. So
can we recommend, even though there's funding, but so like in the UK, they just have free rapid antigen tests. Anyone can get a rapid antigen test, and my friends just get a daily supply so that they're taking one every day. And then, if like pre-screening, like one friend is a dentist, one's a massage therapist, so all their employees taking it before their work day, and then sort of like, then they're okay to work together and then see people. I would say if I ran a healthcare facility, especially, or let's say a nursing care facility, and I had a residential population that was basically only going to get it from anyone coming in, either worker or visitor, I would just limit the testing to at least every visitor and also employee. So that anyone coming in would that day, in the beginning of the day, have to pass an antigen test. They won't be infectious. If they're negative for that
Mhm.
day, they can work, they can visit, and then they can leave. And I mean, like if I had anyone in the care facility, that would make me feel much safer. And
What I'll do
I
is
don't know if there's money or funding for that.
we only have a handful of them, and what I could do, those facilities, what I'll do is I'll call them and again, get the schedule. I know in the beginning, they were required to test, I believe weekly when it was really spreading like wildfire. But I know that they are doing it, but I don't know if it's because they're doing more frequent testing as a
Yeah, but in the
reaction.
beginning, sorry, I didn't mean to cut you off, but I get a little confused when you're talking about testing. Like, so I'm not talking about any of the PCR testing. When they are required to test it, are you saying what tests are they doing? Or the weekly testing, what was that? Was that PCR?
I believe it was a PCR, but I don't want to misquote.
Okay.
I can get all that information. I'll just make up a nice chart, what type of tests are they using in the frequency.
And then I
Um,
would just say, then maybe, I mean, because you can't test visitors. Are there visitors going into the nursing facilities now?
Well, they went under lockdown when we had all those positive cases. And then recently, up until a week or two ago, when all those people came out of isolation and or quarantine, they slowly started opening their services back up and allowing people in.
So I would strongly emphasize that. I don't really, I understand the state is working with whatever resources we have, but it doesn't make sense. And obviously it left proof positive that it's not working, and it leaves these healthcare facilities or the nursing facilities very vulnerable. And we have I mean, like we have what we need now, that like we have legal tests that can test people before they walk into a facility like that. It's
Mhm.
slightly driving me crazy that we're not implementing that, or at least recommending it, or at least teaching a nursing home, like this is what you should do to most ensure that you're not going to bring COVID infectiously into the building. And unfortunately, it's not free here. It's like $13 a test in the market. I'm sure there's not enough antigen tests produced to facilitate every nursing care facility in the country, but
Mhm.
right here, we're not worried about that. Maybe we can at least recommend, like if they have COVID money, which most of us private, like a healthcare facility has been granted, a private healthcare facility or public, you can use it on that.
Okay, so are you recommending that visitors should be tested, or are you?
Visitors and employees should get daily antigen tests. At least, especially, I guess, visitors, because they're not, at least the employees are being tested PCR once a week, but which is not good enough. But visitors aren't coming in with anything other than like a vaccine card, which can be faked or doesn't mean anything or whatever. But really, if you're only coming in for that day, you should be screened at the door for 15 minutes to see if you're infectious, and then you can walk in. I mean, it's so simple.
Okay, yeah, I could do that. I'll
Don't they have to follow like Mass DPH guidelines, right? Like, I mean, we can't, I mean,
It's a
they're
recommendation,
not gonna listen to us.
right? But
I
I mean, if your mom was there, right? Like,
oh no, I agree 100%, Sam. I just, I mean, we're a DPH, we're a federally qualified, we're a community health center, and we're sort of overseen by the DPH as well. And we wanted to test our staff every week, and they're like, no, we're not, I'm not gonna, nobody wanted to pay for that, so I don't know.
is
It's
it
hard
like,
to do more than what the state wants you to do, I think,
it just seems to me like when the state says this is what you should do, then the translation is, oh, that's all you need to do, and that you know, like, why are we having these outbreaks? We did everything the state wanted us to do. And the message should be like, this is definitely not enough what the state's telling you to do. And if you actually want to be safe, this is what you have to do. And there should be some sort of education about that. Like, at least that message should be put forth. I understand before we didn't have access to these tests, so it wasn't possible, so it didn't make sense. But like, we actually have the tools there to implement. And it can save, you know, someone's life. So like, at
Yeah,
least they
no,
should
I
know.
agree. I agree with you. I just, you know,
I understand it won't take place, but for some private facilities, it depends on the leadership too, what they can put on. I don't know. It drives me slightly crazy. That's it. That's all.
Like I said, I'll definitely find out what their practices are, what they're required to do. Because they do have the option that they could be obviously more stricter. And it's funny you mentioned that, because the outbreak we had at Atria, Michael, which is the one where they own their own condos there?
That was Atria.
Atria. So we found out that it started with one resident, obviously. So she owns her own place there. And her son came in and visited her. And he, after the visit or whatever, he got tested a day or two later for whatever reason. He wasn't feeling well. He tested positive. So he called the mom up, said, you better get tested. She tested positive. And then prior to her testing, she had conversations with other people, especially this one person who ended up testing positive, and she in turn spread it, you know, just how the domino effect. So my point is, like you said, it started from someone, a visitor coming in and bringing it in. So, you know, what
And beyond that, if there could be like, I know we're not going to teach everyone everything, and it's not going to translate necessarily to behavior change or policy change, but if, you know, Thanksgiving's coming up this month, and I just would mention to everyone I would care about or want to know, like, same thing for that gathering, you should all test yourselves or get an antigen test before you see your parents, you know, or before you gather. And I feel like if we just rely too much on the state and that translates to, well, that's all you need to do. Similarly to how people said in our last meeting, how there were counselors and things were saying, well, isn't it just like everyone just takes care of themselves now? Like the idea that it's kind of like over like that, because there isn't a lot of push from the state or the federal level. I don't think people understand how we haven't understood and we haven't implemented how testing is another layer of protection besides the masks and the vaccines. Like, yes, you're vaccinated, but you should also be tested, and you can just take an antigen test and they're available at the CVS. And
well, that's like again, the testing kits that we got, it's a Binex testing kit. And I know with the schools, they're not testing everybody per se each day. However, they have, I think they just do the monitoring. But for any type of cases that are positive and it's within the school, I mean, they're giving the kids the option that it's called test and stay. So each day that they come in, they'll be tested. Close contacts will be tested, and if they're negative, then they can attend school, and that's done daily.
that's if they were in contact with someone that was positive? Okay.
Yes, within the school. I mean, they put, you know, the state doesn't make it easy for us to, or for the schools for that matter, to, you know, just blanket test everybody. They
Yeah.
just select, and it's frustrating. You know, I agree. It's
Yeah, it's a failure. you know, not at our level, but just to get those at a public health access level. So, but is there any other outreach we can do where we just like make the message out to people that here's a way, if you're, you know, even if you're anti-mask or anti-vaccine, like this is another like easy way to, that's not so invasive, that you have full control over, et cetera, before you go to this gathering and take responsibility for yourself. Like it's a different message.
Well, I could definitely develop with something, and again, Michael's kind of a whiz at these things as well. So we can put out, you know, holiday safety, you know, whatever you want to call it. Again, so we're not seeing just another outbreak because of what happened with all these Halloween parties and everything. But yeah, we can definitely put out something about that, you know, mask wearing or testing, you know. The other thing is, I'm not sure, or people are calling about these home tests, but we keep on telling them, well, they're really, you know, not as reliable as you may think, but if it's positive, back it up with a PCR test or something like that. So
I would just say the home test is 100% accurate for your infectiousness for that day.
it is
Not,
okay.
yeah, if you're positive, you may or may not be positive for that antigen test. But if you're infectious, the antigen test is going to pick up antigen in your nose, you're infectious. So like that's the most confusing thing for people. I think that's where the education has to be implemented. If I was going to screen you for coming to my house, I would take an antigen test. If you were negative, I wouldn't be scared that you are going to infect me. You might be positive, but I don't care, because all I really care about is whether or not you're going to infect me. And then you could come in. And that bit, I think, it just throws people for a loop when we say, well, they're not as accurate as PCR tests. Like the PCR test sort of is too accurate. I don't really care if you were infectious last week. You know, you can still come to work this week. You know, like it's off a little bit. So I think I would help just a small message about what you could use that for, like going to your mother's house for Thanksgiving, screening yourself for the day, screening someone that was going to come visit you, and just to do it daily if you could.
What I'll do is I'll come up with with a flyer or whatever, and with this information, and then I'll send it to the board before we actually, you know, post it on social media or whatever we do. And I'd welcome any input, and say go with it. Just, you know, it's not anything we're voting on or discussing, but I could just show you. And if you like it, I'll put it right out.
Thank you.
You're welcome. Okay, and I'll find out about the other thing, just because I'm curious to know also what each of these nursing home, the long-term and short-term cares are doing and what they required. So I'll have that information too. I'll send that out prior to the board too, as soon as I get that. And I don't think I have any, I think that's a last of it. Let's see. Vaccinations. Other matters, that's about it. I don't think I'm missing anything, Michael. Do we have anything current that, you know, we have a couple of a hoarding case I'm dealing with, and, you know, the normal board of health stuff we go through. So, but nothing. You know about the mayor. She's on her way out, and I think that's it that I have.
This is a question for you or Robin, but how does that work? Do we meet with the mayor, the new mayor, in the middle of our term? Like, is there like a?
Do we serve the rest of our term, like, or do we have to be reappointed by the new mayor?
No, you serve the rest of your term and you're reappointed when your term runs out, no matter who the mayor is. Now, I was informed by a city councilor that my reappointment had been sitting on his desk for months because of all the COVID stuff and everything that's going around. And he assured me that the reappointment was going to come through. I actually, maybe 6 months ago, somebody from the mayor's office asked me if I wanted to be reappointed, and I said yes. And she listed some things that I had to do, which I've never had to do in the past. And I complied, and that was the last I heard from it. And from what pieces that I'm picking up is this was transferred over to the city councilor, and it's stalled ever since. So I think that as far as reappointments go, we will be notified by either the current mayor or the incoming mayor.
I'll find out about that, Robin, also. I didn't realize that you had, were already approached. So you probably spoke to Donna Wazamichi? Because,
I don't recall.
all right, yeah, because she took over the chief administrative aide, Matt Coogan. Matt Coogan went
Yeah,
to,
it wasn't that. Now, the city councilor that approached me was, let's see, Jim
Yeah,
McCauley.
yeah,
Yeah,
that happened.
he approached me and said it was on his desk and he was going to push it through.
So I got reappointed right before the pandemic, and I think it's because he has it because he's like head of the safety committee, right? And I had to go before the safety committee when I got reappointed this last
oh, you
time.
did? Okay.
Yeah. Which I didn't have to do the first time. I just met with the mayor, and this time I went, and the safety committee had to like vote on it or something, I think, or I don't know.
Wow.
Or I don't know, they interviewed me or something. It was a kind of a, I don't know, I can't remember, but anyways.
I thought it was just appointment by the mayor, but I stand corrected. Okay.
Hey, Frank, I have an issue that I was gonna maybe, I wanted to ask the board about and get some thoughts.
Sure, I mean, yeah, that's why I'm here.
So I don't know if people know that for the most part now, I've kind of morphed into, I'm basically a primary care doctor for people with substance use disorders. And in our world, you know, we talk a lot about fentanyl in our world, and we've been counseling our patients for a long time now. Like sometimes our patients will use things, or they will purchase substances or pills that they think are one thing. And we've known for a long time now that these are often contaminated with fentanyl. And, you know, we warn our patients about this. And also the other thing we observe is sometimes our patients will test positive for very small amounts of fentanyl and marijuana, and they'll say they've used nothing else besides marijuana. And so, and people in the field all sort of recognize that there seems to be some contamination of fentanyl and marijuana. But this kind of became like a bigger concern of mine when I recently was talking to an addiction specialist down at BMC, and she sort of told me that she thought it was feasible that like somebody, like potentially a young person, like it was possible in her mind that they could smoke marijuana and get enough fentanyl to like seriously harm themselves. And I just was wondering, you know, is this something like, you know, we talk about it to our patients, but I just wonder is like, or like a gummy or a pill at a party, is this something like that, like there should be like a public health sort of some messaging around, you know, like if it didn't come from the pharmacy, it's probably got fentanyl in it. And if you don't have tolerance to opioids, you can die, you know, like I just wonder if people should be aware of that.
You're talking about when you say all of these products that were laced were like street bought product, not,
Yeah, so people purchase like an Adderall. And it turns out that a lot of these pills are pressed methamphetamine or pressed fentanyl, or people will purchase what they think is an oxycodone, it's pressed fentanyl.
but street purchase. You don't
Yeah,
mean,
right.
okay,
Yeah.
yeah. I would think that like they don't know that or like,
Well, yeah,
like,
I think, I don't know, like they know that, but does like the kid at the high school know that? Not that we are encouraging people to purchase things off the street, but as we know in public health, sometimes people do things that we don't recommend that they do. And I'm just wondering if, do you think people know that? Did you know that?
yeah, I thought like, I mean, it's
Or like a gummy?
marijuana laced with stuff as, like, I keep remembering that scene in the movie Friday when Chris Tucker was talking about how his marijuana is laced with angel dust, and now he had all these hallucinogens. Like, I've always thought that it can just be laced.
Yeah, everything seems, the issue though is that it's fentanyl now, and it's like which is like this sort of family of compounds that have like really different levels of potency and can be pretty dangerous. There's I think like a cluster of overdoses on Long Island of people that thought they were using cocaine and it was fentanyl, and a couple people died. People use things. I mean, I don't know.
You mean like a poster,
before
like put posters in this, like the high school
no,
that
I
says
don't
like
know.
street drugs could have fentanyl in it, like.
Yeah, the DEA is sending out like stuff to medical professionals now, but I worry about like these gummies, like people's like, are people gonna get these like maybe counterfeit gummies, like kids thinking like, oh, it's just it's THC and who knows what it is. If somebody gives you something, I don't know, it's just something to think about.
Well, we meet with the Beacon Coalition around here.
Yeah, right.
I missed the last meeting only because I chose to enjoy myself down in Cancun. But we meet with that group there, and they have open discussions, and we have people representing our schools, the high school, the middle school. Andrea Edgemont from the Youth Services is there.
Yeah.
And then some other behavioral people. So I'll bring it up and express
That
your
would be a really
concern.
good forum for this, I think, Frank. Thanks for suggesting that. Yeah.
Okay. Yes, I know the focus is to try to get the message out there to the kids. So we talk about, how we can do things either internally or get the message out. But yeah, I'll definitely bring that up because I missed the last meeting, so I'm not sure what transpired during that.
Right on. Thanks, man.
So unless there's anything else to be discussed, we move on to the most important part of the meeting, and that is discussing when we're going to have our next meeting. Now, I'm taking it that this meeting is our October-November meeting. And as far as December goes, we have the Christmas, of course, but the third Thursday would be the 15th.
16th,
16th.
which I can't do, sorry. I already can tell you I can't do that.
Okay, so the question arises. In the past we haven't been dealing with COVID, but taking that into consideration, many times we've just, unless there was something pressing because of the holiday, not doing a meeting in December. Now, Frank, since you're have more insight as to what's is or is not going on. Are we at risk by not having a December meeting?
I don't think we are. I think, again, with all the holidays, I mean, obviously the rest of November is done because we have Thanksgiving there. Unless the board wants to meet even on the 9th, but what I could say is, unless the board feels, or if our numbers start going down, and then I think the only thing out there right now is, excuse me, the mask mandates we have in the 3 buildings. But yeah, the way the numbers are going right now, it's justified that we should continue it. So I think skipping December, again, unless there's something pressing, I can always let the board know. But
And can we meet on the 9th, just the week before, because that's effectively 4 weeks anyway from today? And then we have some time before our holiday parties and all that.
So you want to meet December 9th?
December 9th at 7.
December 9th at 7.
That works for me.
okay, I'll put that in my calendar.
Hopefully the numbers in November won't be as high as October.
Yeah, I'm hoping. Yeah, and I think it's good, like you said, mentioned, Sam, just put out, holiday reminder and this and that, and I can back that up with some data, numbers that to show that we are going up, up, and just remind everybody, get their boosters if they can. Okay,
Can I work with you to put some stuff on the Newburyport social media pages, like just a little blurb or a video?
sure. Do you have something in mind, Sam, now, or you
I was
wanna-
going to make that recommendation to my patients on our social media of, before you gather, you should just do your daily test. It doesn't matter if you don't believe in vaccines or masks or whatever, but like you can purchase this test. It doesn't report to the government. You are in full control, then you can decide, but unless you
Okay,
don't
yeah, if you
believe
have
it.
something already made up, yeah, I can.
I haven't made it yet, but I'll make it, yeah. Because I was gonna do it for the Thanksgiving week, but I guess people need a little bit more heads up, so.
Okay, yeah, if you want to send, or I'll send you something, or you send me something, and then Donna M is the one who's doing the media pages here. So you're saying that just the city website, right? City.
Yeah, city website, and then I could post it on so like there's the different Facebook groups of Newburyport, which I'm not on all of them, but other people can post
Yeah, we
it.
could do something with the library and especially the senior center too. They have good social media pages there too that they can get things out. And also, Andy Edgewater too at their youth services. So, okay.
Okay, well, unless there's anything else to discuss, adjourn this meeting and everybody have a good Thanksgiving.
Thank you, Rob, and then same to everyone too. Happy Thanksgiving.
Happy Thanksgiving.
Thank you.